Hey guys, this is FixerMed. Welcome back to my high-yield hematology and oncology review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering the entire system of hematology and oncology in a comprehensive but high-yield manner. This will be part 13 of my multi-part video series of doing so. Today, we will be taking a look at leukemoid reactions. Without any further delay, let's go ahead and get started on today's content. Let's take a look at leukemoid reaction. Definition: exaggerated immune response to infection with a significant increase in white blood cells, resembling leukemia. Key concept: the ending oid means looks like but isn't. High white blood cell count mimicking leukemia but isn't leukemia. Normal WBC count: 4,000 to 11,000 per microliter. Typical infections raise white blood cells to the teens, or 20,000s per microliter. Critical threshold: white blood cell levels are greater than 30,000 per microliter are rare even in severe infections. Consider leukemia, but if ruled out, it's termed leukemoid reaction. Let's take a look at clinical clues. Key indicators: infection and white blood cells are greater than per 30,000 per microliter. Blood smear shows neutrophilia, lots of neutrophils. Leukocyte ALP, elevated in leukemoid reaction, low in CML. USMLE clues: blood smear indicating neutrophilia or descriptions of reactive granulocytosis, or increased release of leukocytes from bone marrow post-mitotic reserve pool. Example: question, UTI plus white blood cells, 32,000 per microliter and smear showing neutrophilia. Answer: leukemoid reaction. Alright guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 45-year-old male presents to the emergency department with fever, chills, and dysuria. His past medical history is unremarkable. On physical examination, he appears ill with a temperature of 39 degrees Celsius, 102.2 degrees Fahrenheit. Laboratory tests reveal a white blood cell, WBC count of 32,000 per microliter, with predominant neutrophils. A blood smear shows marked neutrophilia. Leukocyte alkaline phosphatase, ALP levels are elevated. Which of the following is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, leukemoid reaction. The patient's clinical presentation of fever, chills, and dysuria suggests an infection, likely a urinary tract infection, UTI. The markedly elevated white blood cell count, 32,000 per microliter, with predominant neutrophils and elevated leukocyte ALP levels indicate an exaggerated immune response rather than leukemia. Leukemoid reaction is a condition where the WBC count is significantly elevated in response to an infection or other stressors, mimicking leukemia but not actually being leukemia. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, chronic myeloid leukemia, CML, is incorrect because although CML can present with high WBC counts, it typically features low leukocyte ALP levels and is not primarily triggered by an acute infection. B, acute myeloid leukemia, AML, is incorrect, as AML is a malignancy that presents with symptoms of bone marrow failure, for example anemia, thrombocytopenia, and does not typically result in such a high WBC count in response to infection alone. D, infectious mononucleosis is incorrect because it generally presents with lymphocytosis rather than neutrophilia, and WBC counts do not typically reach such high levels. E, severe sepsis is incorrect because while it can cause elevated WBC counts, the description of a blood smear with marked neutrophilia and elevated leukocyte ALP levels is more indicative of a leukemoid reaction, distinguishing it from typical sepsis presentations. All right, now that we have covered this question, let's move on to look at the next question. A 38-year-old woman presents to the clinic with a 3-day history of fever, productive cough, and pleuritic chest pain. She denies any significant past medical history. Physical examination reveals crackles in the right lower lung field. Laboratory tests show a white blood cell, WBC, count of 35,000 per microliter, with a differential revealing 90% neutrophils. A blood smear confirms marked neutrophilia, and leukocyte alkaline phosphatase, ALP levels are elevated. What is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, leukemoid reaction. The patient's symptoms of fever, productive cough, and pleuritic chest pain suggest an acute pulmonary infection, likely pneumonia. The significantly elevated WBC count of 35,000 per microliter with a predominance of neutrophils and elevated leukocyte ALP levels point towards a leukemoid reaction. This condition is characterized by a marked increase in WBCs in response to severe infection or stress, mimicking the presentation of leukemia but without being a malignancy. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Chronic myeloid leukemia, CML, is incorrect because CML typically presents with a high WBC count, but leukocyte ALP levels are usually low, not elevated. Additionally, CML is a chronic condition and not typically precipitated by an acute infection. B. Acute lymphoblastic leukemia, ALL, is incorrect because ALL generally presents with a combination of symptoms including fatigue, anemia, and thrombocytopenia, rather than isolated neutrophilia in response to infection. D. Tuberculosis is incorrect because while TB can cause chronic infection and elevated WBC counts, it usually does not present with such an acute rise in neutrophils and elevated leukocyte ALP as seen in leukemoid reaction. E. Myelodysplastic syndrome is incorrect because this condition typically presents with cytopenias, anemia, neutropenia, and thrombocytopenia, rather than an elevated WBC count. Myelodysplastic syndrome is also a chronic bone marrow disorder, not an acute reaction to infection. All right, guys, that is all I have for today. Be sure to leave a like if you found this video useful, a dislike if you did not find this video useful, and consider subscribing for more content like this in the future. If you would like to check out more review material, be sure to check out my other USMLE/NBME playlists on the channel. If you have any questions, comments, concerns, or suggestions you would like to make, please be sure to write them up and submit them in the comment section below. This is FixerMed signing off. Be sure to have a great day or great night, and as always, good luck studying.